Number of children that are struggling with mental health issues is on the rise, and many parents may not know what the first step is to take. So joining us for this morning's STL Moms Report is Dr. Joseph Munster with the SSM Health Medical Group. Good morning, doctor.
Good morning. Thanks for having me on today.
We look forward to chatting with you a little bit about these warning signs that parents need to look for and what the first step is they need to take. What would you tell people?
I think it's been tough during the pandemic on lots of families. Kids are going through lots of social isolation at home, not being in school. And, parents too, there's parents that are out of work, may have health issues of their own, and that rubs off on kids a lot. I think some of the key things to look for in children would be negative self-talk, seeming more down if they're talking of hurting themselves, sleeping more, and some fatigue and not, their normal energy level, and just withdrawing from the rest of the family in general.
And what ages are most impacted that you're seeing right now with mental health issues? And can you talk to us about the pandemic? How is that playing a role in everything?
Yeah, there's been a palpable increase in visits to my office with kids with mental health issues. I mean, even kids at preschool age, as young as 4 or 5, we're seeing increases in, anxiety. People are just stuck at home, going a little stir crazy at the house, all the way up to teenagers in high school with, everything from suicide attempts and, suicidal thoughts and ideation. So the age range really varies.
What is the first step that a parent needs to take if they start sensing there could be something going on with their child?
I think most importantly, if you ever have any, significant concerns that your child is going to kill themselves or talking of hurting themselves, I would call 911 or go to your local emergency department. If there's just, some depression and anxiety and not things that you're immediately concerned about, they're, a danger to themselves or others, I would call your pediatrician first. SSM has a new urgent care a mental health urgent care up at DePaul Hospital that's been a really good outlet for kind of, urgent things that don't necessarily need to go to the emergency room. It opened during the pandemic, which was good timing.
And they are seeing pediatric patients ages 5 years and older. How exactly do the treatments work there, and how do people get signed up for that?
They do take walk-ins. You can always talk to your pediatrician or your doctor about ways to be seen there. The urgent care is really more to bridge the gap and to plug people in with resources in their community. If a child, is in desperate need of any sort of medication, they'll kind of help start those sorts of things. But it's really that first step in getting someone plugged in with more consistent mental health treatment.
Such good information, doctor. Thank you for filling us in on all of this. We appreciate your time. And for anybody who's watching, we are going to link the details that we spoke about on the morning show section of fox2now.com.